first, I would like to ask for your both permission to use this video for educational purpose and on internet.
You have mine.
Yes.
Thank you. Why don't you tell me about your symptoms? 1 to 10, how bad is the pain?
About a 20.
20. How long have...
Got worse, and when I had my last surgery,
Okay.
it,
Flared up.
instead of making me better, it got worse.
Yeah. Now, in those kind of surgery, what we do, we go and literally bite on the bone to open up the space for the nerves. Now, it happened to be that, call it God, call it nature, put that bone there for a reason. Once we bite on that bone, we make the spine weaker. Alternatively, we put metal in to strengthen it. It's called fusion. And that is a more definitive kind of surgery, but that makes the surgery much, much longer in the old-fashioned way. But now, you have been getting worse for the last few years, and you're telling me you have pain 20.
Well, the last 3 doctors I saw, they all told me that I had a 50-50 chance of coming off the table alive.
What did they tell you about the surgery itself?
Yeah, not much. They didn't say anything about, they just told me that's why they wouldn't touch me.
Okay, but they did tell you you need a surgery, but they just
Oh,
cannot
yeah.
do that. So
They
it's
said that I needed the surgery to get better, but they wouldn't do it because I only have a 50-50 chance of coming off the table alive.
yeah.
And like I told them, I'd rather take the 50-50 chance
Then live with this pain.
than my life has no quality.
Yeah, unfortunately, your story is not unique in a way that lots of people go through the same kind of problem with this horrible pain. And the reality is, those doctors are good doctors. They know their 8-10 hour surgery is it's extremely, extremely dangerous to you, and they don't want to hurt you. But I think what the difference is that we do that 8-hour surgery in 1 hour, so we can reduce the time of the surgery. Our blood loss is like 1/10 of the open surgery, and sort of doing a 10-hour surgery or doing a 1-hour surgery is just a different kind of surgery, and that sort of by us reducing the risks, we can offer that our surgery to people who are not a good candidate for open surgery. Now, you're telling me even if I could take half of the pain away, that...
I'd be heaven sent.
Yeah. Now, this pain obviously affects your entire system. You cannot walk, or how far can you walk?
With my walker,
Maybe to
30 feet.
maybe to the desk. I mean, what about without the walker?
Without the walker, I couldn't make it to the desk.
And and that is another thing that we doctors, we decide not to fix your back, but as well there's a consequence to that. If you cannot walk, your body shuts down. Our body is made to walk. And we lose your condition if you don't walk. And sort of you are pushing the risks from the back to the heart and lung because we are losing condition by telling people to go live with it. And this is not livable.
Right.
This pain is not livable. Now, we looked at the films. There's not a question you need a surgery. The question is, how can we do that the safest we can? And by us making, instead of open surgery, minimal invasive surgery, you're all of a sudden making something possible that in open surgery is not possible, it's too dangerous. It still is a surgery, still doesn't come free of risk, and no surgery does. But by us reducing the chance, at least it's a reasonable option. Now, we will contact your family doctor, and if he can clear you for a 1.5 hour surgery, which is very different than from a 8-hour surgery, then we will give you the option of that OLLIF procedure. You have 3 bad discs that literally absolutely explain your problem, and there's not a question. And the other doctors told you as well, you need a surgery. They don't want to do it because in their hand it's dangerous. But if your doctor can clear you for a 1.5 hour surgery, we will take care of you. Okay, how old are you?
70, I'll be 78 next month.
Okay, you are neither the oldest nor the sickest person I have done OLLIF procedure on. So as long as your family doctor is on board, we'll take care of you, okay?
Okay, sounds wonderful.
Now, as well, you told me a story about that you have as well back problem, and
Yeah, I have.
tell me your story.
I've had back problems for maybe 10 to 15 years. I've had probably over 50 injections, you know, at several different places and pain centers or
Yeah.
clinics or,
So you both have maximized the conservative therapy.
yeah. And then I was seeing a surgeon in the
But
Twin
mainly-
Cities, and they could put a rod and screw on my back,
The fusion.
or, yeah, and I said that you could come out better or worse, you know, there's no guarantee, and
And
recovery would be like a couple months, and
Yeah.
even just taking 2 months off work, I couldn't do that, I can't take a week off work, it's,
yeah. Well, generally, when we do our surgery with the OLLIF technique, vast majority of the patients are back within 2 to 4 weeks to the basic previous life. Obviously, if you have a heavy demanding construction job, it's a different. But if you have a desk job, many of my patients go within weeks, literally within 2 weeks back to the their desk job. And we have as well people who have more demanding job that go much sooner than open surgery. And if people understand what the difference is, that how much less we damage the tissue to get the job done, that makes sense, that people just heal and recover faster from that. But that is as well nothing unusual, that you know that people need months to recover after open surgery, whereas they need weeks to recover after our surgery. So
oh yeah, that would be great.
unfortunately, both your stories are not unique. And I think that is I like to do this video, because I think there's a value of what we do, and we have 1,000 patients showing the result of that. And to this date, many of my colleagues that do similar thing that I do, minimal invasive surgery, when they go and talk to my colleague, they're apologetic about that we do those surgeries minimal invasively, because the vast majority of our colleagues, they don't want to go back and learn it doing minimal invasively, and you know, doing in a less invasive fashion, because that requires lots of time and effort and resources to go and learn that. So and I'm hoping this video, these personal stories can change that. Okay.
Yeah, I mean,
So that
don't
is
you
what-
feel,
Thank you so much.
don't you feel, Claire, like the pain just takes your life away? It
Yes,
just,
it
Oh,
does.
yeah.
I mean, it's changed my whole life.
I
the
love the
last-
garden. And now, last spring, I planted plants,
Yeah.
but I
Yeah.
can't take care of them.
No, I hear that a lot, that you know, people tell me, even if I die, I don't want to live like this. I hear that a lot.
Mhm.
Obviously, we never do the surgery that there is a truly high risk of you dying of that. We don't operate on 50-50s, we don't.
Mhm.
Okay, that's why the other surgeon don't want to give you even the option, because truly that is a 50-50 chance. It is not even close to that. Obviously, always the risk, but I wouldn't give you that option if your option was only, if your chance was 50-50. Okay, so we have much better chance. Obviously, every surgery has risk. No surgery is 100%, but
Mhm.
doing what we have shown, that doing our surgery in your age group is very acceptable. And again, I'm repeating myself. You're neither the oldest nor the sickest person I have done this surgery on successfully. So that's why I'm going to give you the option. Okay. Well, thank you for the interview. Okay. Thank you.